Good morning, good afternoon, everyone. This is Jonathan Edelheit, founder of Global Healthcare Resources and chairman. Excited to bring back the rock stars in the industry for, I think, one of our record-breaking webinars that we've done. We've got Steve, Jake, Ron, and Chris on the call with us. And last year, we rolled out this webinar, Innovation in Self-Funding in Healthcare, Employer Healthcare and Benefits. And we had our largest participation ever. It kind of like broke our webinar system where it maxed out at like 1,200. And this year we kind of expanded that, and we broke last year's record. I think we're close to 1,300 registrants for today's webinar. We had the same, because it was so successful as a webinar, we brought it as a session to our conference last year in LA. And it was standing room only in our most popular session. So I don't know if it's these beautiful guys on the webinar today.
Yes.
You know, we might have to create a calendar, the men of, self-funded healthcare and benefits, and see if it's that. Or it's just that, I think that this is such an important topic as, costs increase, as there are 1,000 vendors in the space and solution providers all saying they're innovative. I think there's a lot of shiny baubles. It's really difficult to figure out what works and what isn't, whether you're an employer or a broker or health plan or carrier. And I think it's going to get even more confusing, as time goes on. So, we're really committed and focused on bringing innovation and disruption. And we actually rebranded our conference this year after 10 years from the Employer Healthcare and Benefits Congress to Healthcare Revolution, because we said, look, after 10 years of doing this and bringing the industry together, we've watched it advance, but start feel like I'm seeing it roll back, where it's difficult to make change. It's difficult to lower costs. And like I said earlier, it's difficult to really find innovation. So we said, going forward, we're going to focus on disruption and innovation. And I think it's to filter through the what works and also the crap. It's really difficult today. So Jake is going to be moderating our webinar today along with myself, and I'll be jumping in a second. But first, I wanted to run through a couple things. We're going to be duplicating this same panel at Healthcare Revolution this year, which will be October 28th to the 30th, 2018. So if it isn't just the topic, but it's that these are the calendar men of the benefits industry, you can meet them in person and get your calendar signed in Orlando. But as I said, this is a merging of our events that we've hosted for the last 2 years into one event. And we have a lot of great employers coming from Harley Davidson, GE, Pepsi, American Airlines, HP, Southwest Airlines, all coming to share what are they doing disruptive, what are they doing that's innovative. One of them that's speaking originally, their title that we had come up with was Catch Me If You Can, How to Steal $1 Million from Your Self-Funded Healthcare Plan. Didn't make it through corporate compliance, but really loved the topic and the title. Maybe you could take a guess based upon this page what potential speaker or company it was, based upon Leonardo DiCaprio's movie, but really trying to get a little bit fun with it and really dive into, dive into what are some of these guys doing and some of these ladies that is really different and unique. And we're also rolling out some summits this year to have really focused conversations. A summit on obviously innovation and self-funding, but we're having a specialty drug summit, a business of genomics summit, direct contracting and bundled payments, mental health and behavioral health. Also the opioids and substance abuse, that becomes a really big issue. And we're doing a market disrupt venture pitch event, which most of these guys are participating in. So people this year are going to be able to pitch in front of investors or pitch in front of some of the top consultants and brokers, and also pitch in front of some of the employers, their company. So it doesn't matter whether you're trying to raise money, get pilots. We're really trying to expand it. So encourage, if anyone on this call is a company that's doing something innovative or disruptive, to apply to be in one of those pitch events on our website. And also we're doing awards this year, rolling back out our Wellbeing 100 Awards to recognize some of the champions within employers, but also the consulting firms and brokers. So some of the finalists are like Pepsi and Toyota and Aon and HAG. So if you know anyone within companies that are doing stuff that's really innovative in wellness and well-being, go ahead and nominate them or recommend them. And we're also rolling out innovation awards this year to some of the most innovative companies. And so, yeah, there's going to be some big names that I think you'll be, expect to be on there, but we're really looking for some of those startups or mid-stage companies that are in different areas that are really doing something that has a chance to disrupt or really make a difference in this space. So anybody who, knows any, please recommend them to apply to the Innovation Awards. It's a big part of what we want to bring to our event going forward. And hope to see everybody in October. And anyone who's on this webinar, there's a, just changed on here, took off the slide, but there's a special code that you'll have where you get $800 off if you're listening to the webinar by using Disrupt18 at the website to get $1,200 for registration. So with that, one area I invited Jake Vali on the webinar today he's the co-founder and CEO of RX Precision, kind of a health IT company doing some interesting stuff in genomics and pharmacogenomics, and they're also the sponsor of the webinar today. And the reason why I wanted him to participate on the webinar is the last year I did a deep dive into genomics after Craig Venter, who mapped the human genome like a decade ago, had approached our company to talk about genomics in the self-funded employer space. And in that first 15 minutes, the light bulb went off where I realized, this could be really disruptive. It could create real consumer engagement. It could create awareness and aha moments for people to get more engaged in their healthcare. And we spent the last year digging in and looking and talking to all the labs, talking to all the technology companies doing stuff in genomics, because a lot of companies are starting to get pitched from people doing cancer and whole genome and pharmacogenomics, and really unraveling the thread, the yarn, and looking at what is going to work or what doesn't. Because the biggest thing that we see is if this could be disruptive to the self-funded space, I want the best solutions to come forth to the employers and not for solutions to come in that won't work. So on the pharmacogenomics side, I just had my pharmacogenomics test done, where now I know what drugs I should take, what drugs I shouldn't take based upon my DNA, what are toxic drugs. I had my fitness genetics done, my nutrition. Unfortunately, I had one of my something stolen from me. I can no longer say I need to drink 1 or 2 glasses of wine per night because it's healthy for me, because I found out I'm a high metabolizer of alcohol. So I don't have that excuse anymore. But it's, the awareness that I bring, I think, is what really changes. But it's not, you can't just roll something out like that and expect it to be adopted, because it's all about how it's integrated. And so, Jake he founded several other companies. He's run clinics. I think he's focused on the health IT side of it, the technology of how do you engage it, the analytics, but also the clinical and the concierge side. Because the biggest thing that we found after a year is the lab producing the genomic test, whether it's cancer, RX, that's a commodity. It's how do you change either the patient's behavior and get them engaged, or how do you engage the pharmacist or the doctor? And so, I thought he would bring a very interesting perspective to the conversation, because there's not many people doing disruptive things out there, and I see him really doing it, and he's a great guy. So with that, I would love to turn over the webinar to Jake to kick everything off.
Sounds great. Thank you, Jonathan, for that introduction. Just to give you guys a quick background on RX Precision and where it came from. I do a lot of work on the clinical side of risk management, cost containment in the enterprise and commercial industry. And we've been watching genomics for quite a while. And when it comes to, I want to differentiate when I talk about genomics, because when I'm talking about genomics, I'm talking about medical genomics. All other genomics are kind of, I guess, what we would call recreational genomics in our company. We definitely think they're great, and I think there's a lot of really fun things that you can learn from them, and even useful things on the health risk side and nutrition side. But medical genomics is what we are focused on. That's the ability to actually apply genomics research and the findings behind someone's DNA to change and influence clinical services, and to be able to change and influence a doctor's prescription and treatment today. And I think that's the big thing that all of us in the commercial industry and insurance industry need to focus on when we start with genomics is where do we start? There's a ton of stuff out there. And what we need to do is we need to look at the stuff that's going to influence our health plans today. And it's going to influence our employees' lives today. It's going to help the presenteeism and absenteeism problems today. So, our platform was designed specifically around this industry. And our goal was not to be a lab, but to work with all of the best labs around the country and to develop a platform that could take in data from health plans and from EMRs and really anywhere where there's a good data source and actually be able to identify the members within a high-risk population who would most benefit from a genomic intervention, and then automate that entire process and provide the peer-to-peer support to the physicians on the ground to actually get the outcome into clinical action, because that's one of the greatest deterrents of genomics actually making a difference today. So that's just a quick background on what we're doing at RX Precision. I look forward to meeting everybody in Orlando and talking a little bit more about that. But with no further ado, I need to introduce the real reason everyone came today. So first of all, we have Steve Blumenfield. He was the Senior Director of Strategic Opportunities and Alliances at Willis Towers Watson. We also have Chris Chan, Lead Innovation Imagineer. Man, I gotta practice that. I practiced it like 10 times from Mercer Labs. And Dr. Ron Leopold, who's the Chief Medical Officer for Locked-In Benefits Group. So thank you guys for making time out of your busy schedules to join us again for this fantastic webinar. So we'll start off. Let's get the first question going. Let's have Steve start. I know he's chomping at the bit to get going here. So how will new technologies change how medical care is delivered, and what should employers keep their eyes on?
Well, thanks, Jake, for that question. Hi, everybody. Thank you for taking time to listen to us three knuckleheads give opinions on stuff. I think there's just tremendous technologies. We see them every day coming out in different ways. But the things that I think are most highest potential in terms of changing medical care are things like adding convenience, precision, and relationship. What does convenience mean? Convenience means the member can pick the time and location themselves and fit solutions and care into their lives, not at the time that someone else is telling them or at the appointment someone else fits them into. Precision, and what you do as a business, Jake, speaks to the power of that, but precision to target a condition specifically and to go after the most important variables at getting at that condition. And then adding the element, surprisingly, of relationship, the longitudinal connection we have with that care. We used to find this from our primary care physicians. We really don't get that anymore today, where a lot of care is more transactional. So interestingly and surprisingly to me, you can get a longitudinal relationship with care delivered through technologies in the right way. So I think employers would want to look at those things: convenience, precision, and relationship. And but look, it's not a panacea. There's always something new, and it always does great things, but not as much as we want it to do. But I do think that employers will want to look at those things. Chris, Ron, what are your thoughts on that?
Yeah.
I'll go next. Okay, Chris. I think those are all certainly emerging ideas. There's two that come to mind for me to focus on, and these are emerging and trendy buzzwords. The first is the Internet of Things, and the idea that every object in the world around us is going to have a sensor and be monitoring and measuring and reporting out and responding to people and actions within the environment that those objects fit in. And so there's the connected home, the connected office, the connected clinic, and we're starting to see this emerge. There's things like Forward Clinic that has lots and lots of different sensors and things automated in the background to get to some of that convenience and reduce friction that Steve just alluded to. So much more in the IoT space to come. And the second buzzwordy trend is around virtual, synthetic, virtual assistants, virtual reality, augmented reality, chatbots, artificial intelligence. The idea of trying to supplement humans and reduce labor costs so that we can have practitioners and clinicians operate at the top of their license, and the lower level administrative operational tasks get handled in the background by computers. And some of those chatbots are consumer facing and some of them are coach or provider facing, all to help reduce that friction and increase the convenience. And then just two specific investments and acquisitions that I'll leave on, Amazon and PillPack, and then Alphabet and Oscar Health. Alphabet being the parent company of Google. So interesting times that we're living in.
Hey, Ron, before you go, I just wanted to point out for the audience, if they don't know, that Chris Chan is actually a chatbot. We're rolling him out today.
Very realistic. It's very convincing.
Let me add my 2 cents. I think, Jake, when I listened to the question, there's 2 things to think about from my perspective. And I think throughout this, we're going to hear lots of different perspectives between Steve, Chris, and I. The first first thing I think employers need to think about is, what can I buy into? And what we're starting to see is a lot of bundling of services in ways that we haven't seen bundled before. Comprehensive fertility, infertility, and fertility benefits management, for instance, is something that we're seeing bundling together, that for some employers who view this as a real positive for employee engagement, retention of that's real valuable. Bundled surgery, where the price is fixed and all the services come bundled with that. We're seeing more and more solutions around maternity and neonatal solutions. We're seeing more around musculoskeletal and bringing in much more of a coordinated package, utilizing some of the virtual capabilities in terms of physical therapy and occupational therapy through telemedicine, et cetera, bundled with a case management approach. That's one thing. So the technology here is as much about the marketplace bringing together lots of different formerly disparate groups together in something that you can plug into for a much better experience for those employees that need to avail themselves of infertility benefits, back injury, pregnancy. The second thing, which we didn't talk a lot about last year, but I'm spending a lot of time and want to start promoting, is regardless of who you are as an employer, you're covering medical, and there are a lot of medical advances out there that are exploding. Specialty medicine, I'm sure we'll touch on. Jonathan mentioned that there's an entire track devoted to specialty medicine. From a cost perspective, from a treatment of rare disease perspective, that's huge. We believe that that employers need to understand what's coming down the pike. Couple of examples that come to mind to think about. Gene therapy, a whole new way of introducing treatment, which is a great solution for people with monogenic disorders like sickle cell, cystic fibrosis, hemophilia, Parkinson's, Gaucher's disease, all rare but very expensive diseases that are seeing new treatments that introduce wonderful new promise for people with these diseases, but they're expensive. How are we going to control that? Things like proton beam therapy, treatment costs $25,000 per. For a hospital to introduce proton beam therapy, $20 to $100 million investment, but it's only medically proven for cranial and hepatocellular tumors. But the potential application for other cancers like cervical, breast, prostate, pancreatic is there, but it hasn't been medically proven. But there's a lot of interest in pursuing that. So I think we as an industry have to start really preparing ourselves for recognizing that we're going to have to solve for a lot of really complicated medical science, new clinical technologies, not just pharmaceutical, but also medical devices. We're seeing 3D printing as for surgical tools and for surgical implants, which is crazy cool. It's going to do some miraculous things, but it's going to be very costly. What do we pay for? What do we not? So when I think about new technologies and how medical care is delivered, I think it's important not only what are we buying into, but also what's happening out there in the medical world, that those of us that are looking at individual claims and helping employer clients determine what should we do, how do we work with the carrier to make sure that the right solution happens.
I just want to chime in with one of the points that Ron touched on, and it is certainly an amazing time that we live in right now, with all these new technologies and therapies right around the corner. There's always the question around what's clinically appropriate and the cost benefit analysis around, how much is the right amount to spend to address some of these very serious conditions and issues. What we're starting to think about is a shift from annual benefit cycles to decades-long or lifetime-long benefit value that's achieved through these new treatments. And for some employers, they're going to look at that and say, wow, I want to be able to be an employer of choice and hang on to my talent and offer the best that I can, because we have people who stay for fair amounts of their career. And so they're going to make that investment. And then others who might have shorter tenure and higher cycles of turnover, who are going to look at that and say, there's just no way I can justify that type of expense for a population that might stay 1 or 2 years. And so, unfortunately, that, whether you like the term or not, that leads to a bifurcation of the market in terms of haves versus have-nots around what employers are willing to offer. And there are some questions around whether the latest science and treatment and technology, they're going to go overseas where, there's a single payer who is on the hook for the lifetime value of every covered citizen at the end of the day. And they're going to be willing to make the upfront investments to counteract some of those long costs. So there's a lot in there around ethical considerations for what to cover in the future.
Chris,
boy, I just want to add to that. It gets really, really interesting and really expensive really fast. Everybody wants to value price what they think are innovations, especially those that have an impact on lives. And how do you value a life? But at some point, the ability to pay will crush and eat everything else. And there's just a limit out there. And what I'm really most excited about is innovators that can transform care, new technologies that change care, that take us out of those costly paradigms that have become the norm and wipe out costs. And if you think about things like Amazon, the three great companies trying to tackle this on their own, well, what's the first thing everyone goes to? Oh my God, cost. And it transforms the industry that arguably run into each other's arms in response to the potential of losing profitability. I'm eager to see these innovators and new technologies take a different approach and not take for granted that you can always just charge a little bit more or a little bit more value, and there will be more value. I want to see markets transform by taking significant cost out of the system and making people healthier. I don't know why that wouldn't be possible to do both.
I do want to point out, Steve, on that point. This is important. Some of the technologies do come into play when there are failures of medical care upstream, in primary care or in the initial phases of the disease. We are seeing an increasing number of specialty medicines, gene therapies, and other solutions that are opening the doors for people where in the past there was no solution whatsoever. So the keeping people healthy paradigm remains vitally important. Some, not all of the new technology challenges are going to be independent from that paradigm, from that pathway. Some of these are just, lupus is a perfect example. Most people on this webinar probably know somebody who's had lupus. Lupus can be mild, moderate, or very severe. There's nothing you can do to prevent lupus. You're wired for the lupus for the most part. For the most part, it's genetic. So it's important to also realize that some of the big wins, some of the big expenses in technology are going to come from those kinds of diseases. I just wanted to make that point.
To follow up on Chris, what you were just saying too is I was actually had a phone call this morning with an employer, and exactly what you said came up, where they basically said, well, the average time an employee is with us is 2.5 years, so why would I invest in that? And, and I basically, then on a separate call was talking to another technology company. I was saying, you guys may want to go overseas, whether it's the Caribbean or the Middle East, where you've got a government that's covering the citizens for their lifetime. And I also it made me think about it, like, could there be innovation, like if certain U.S. technology companies were able to do pilots overseas, could they then somehow come back and use that data here in the U.S.? If some, because they don't have the clients that are willing to make those long-term commitments. So it's interesting because I feel like it hurts us with innovation here in the U.S.
Well, our hope is a rising tide will lift all boats, and savvy employers will realize maybe it's only the first couple of years they benefit from, but years 3 through 5, they're going to pick up another employee who got the coverage from somewhere else. And it's hard to follow the math all the way through over a 10 or 20 year cycle. And completely understandable that businesses are all structured differently and there's different types of profitability. So there's going to be some challenging decisions that employers are going to have to make.
And that the overseas element there, Jonathan, those payers, those governments, and the buy-up plans that are available in many, because every country is different, available in many of those countries, they're pretty strict about what they cover. So I think a lot of companies in the U.S. start in the U.S. because this is a pretty open market with no mandatory pricing. In fact, we often separate pricing out from the care decision. Many other countries, there's just a no. Sorry, no, we're going to wait, or we're just not going to cover this. You're going to have to give us value-based pricing to start. So I would love to see what you're seeing happen, provided environment to test these things out and really get that data pulled in. But there are some challenges with just going overseas for that as well.
Well, the overseas thing, not to keep talking about that piece, but I think it's the expats and the foreigners that they're creating those restrictions around. Because if it's locals, like it's the actual Emiratis in the United Arab Emirates or the Saudis, they're citizens, they'll pay for almost anything. And can you run pilots with those groups? But I completely understand what you're saying, Steve.
All right, so let's move on. I think this is a pretty good segue. Ron, I'll start with you on this one. How do you think employers can leverage data analytics in these new and innovative types of technologies to meet their goals related to benefits and human capital?
Great question, and a couple of thoughts. We all of us in our work lifetimes have lived through remarkable times when it comes to data analytics, and I keep thinking in terms of the more we're able to take data sets and integrate them, the smarter we become. So it's two things. One is, what are the disparate data sets? Can they be combined? And then when they're combined, what can we do with them? And there are a host of other things that you want to think about in terms of doing that. So in the past, we took medical, then we took pharmacy, we put them together. We got a much better understanding of cost of disease, overall costs, et cetera. What we're starting to see, some areas that we're starting to look at is pairing medical absence, short-term disability, long-term disability, casual absence, FML, with company work performance. So, your question included benefits and human capital goals. So starting to get at who's working well and whether or not absence is a factor. Are there patterns and trends that help us identify particular departments, particular geographies for our company, particular company policies, other human capital concerns that we want to look at? Some other examples, short and long-term disability, especially longer short-term disability, so an absence of, let's say, 3 months plus as a predictor of high-cost claimants going forward is one powerful way that very few companies are leveraging, but could leverage data that they have already. An area that is becoming more prevalent, but I think that we should remind ourselves is biometric data and medical and pharmacy claims. Are there members who in biometrics were able to identify have high blood pressure, high cholesterol, high blood sugar, who have not been seen, not been evaluated, not been treated, which we know from the medical claims data for hypertension, hypercholesterolemia, or for diabetes. Looking at wellness participation and seeing if that's a driver of employee engagement data, absence data, or productivity data. Taking company data and bringing in social determinants of health, so a lot of publicly available data down to the zip code, even finer areas to understand socioeconomics. Two more and then I'll stop. Predictive analytics. What can we tell our employers about their high-cost claimants today, tomorrow? So is this $100,000 claimant going to be $100,000 next year? And increasingly, predictive analytics can allow us to do that. And then pipeline analysis. So a lot of what we've just talked about, new pharmaceuticals, new medical treatments, being able to help an employer today look at their data, think through what's available out there, or rather what's coming down the pipe, what's literally in the FDA pipeline, and what are some of the future expenses that you might want to think about. So a whole bunch in there, but a common thread is starting to be more creative and pairing data that you've always had with new data sets.
Ron, you're gonna hate my comment. I love all the stuff that you said, but we're awash in data more than any other time in healthcare, but I'm really skeptical that we're going to get it right this time. You know, dozens of years ago, we started collecting data and marrying pharmacy data with medical data and looking at leave data. And we do this from time to time in the industry, and more companies are doing this and getting better and sharper at it. I think that's actually fantastic. The problem is people don't want to be managed. Like, that to me is the fundamental flaw at the bottom of this pool of data that we need to look at really, really carefully. Figure out how we can use that data creatively to help people want to take care of themselves, help them to be smarter about themselves, help our solutions be smarter. What really excites me about data is not those type of things. Like, every time we hear of what IBM Watson is trying to do and what Google might do and Microsoft, and these are great things, they're aspirational, they'll probably yield wonderful things at some point in some time in the future. I think pragmatically in people's lives, you have to take advantage of the teachable moments that data gives you, and we're learning more and more and more. Smart solutions being built today are gathering massive amounts of data that allow them in a very specific area to treat a condition more effectively than ever before. We can sharpen our offerings, use behavioral economics to tweak and encourage and keep people, maintain that relationship, build on that. So just one example from a small company we came across in one of our VC meetings called Wobot, in the space of great need that you mentioned before, Ron, behavioral health. This is a chatbot. Chris, you mentioned chatbots before. A chatbot that's out there, and before it's even been sold to a single employer, it's already collecting 2 million interactions with consumers every week. Every week. That level of data, you could aggregate every therapist you know, and over a lifetime, you're not going to find that number of interactions. They're collecting that each week. That enables them to be sharper and sharper, better and better, feed other tools. So that's one example. I'm really excited about our ability within specific solutions to use the great things we've learned about engaging people. And there's another topic on that, which we'll get into in a different question, I'm sure. But then gather that data and sharpen our approach, take advantage of those teachable moments when people raise their hands and say, I'm ready, and I'm a little more skeptical of our ability to create a pool of people and say, okay, go after them with care management, and we're gonna get it right with them this time.
I think I sit in between, Steve and Ron. I think there's points on both sides that I agree with. Just picking up on the social determinants of health comment that Ron mentioned, it's very trendy right now. And in fact, it hit its all-time high on Google search trends earlier this year. And so thinking about the community and the environment and the social conditions, education, economic stability, housing, transportation, safety, access, literacy, affordability. There's just all these different aspects to think about in people's real lives. And I think that's part of Steve's point. Also, you got to think about the real context that people are living in to create and utilize that data to create experiences that people will actually engage in. So I have a hypothesis that there are two key questions to ask anyone who's looking to change a health habit. And those are, one, do you have school-aged children? And two, how many hours of free time do you have on any given day? And if you're a female head of household, it's probably not hours. It's probably minutes of free time that you have for your own personal self. And those minutes or hours are all the time that we have to make better decisions, eat right, meal prep, financial budgeting, exercise, meditation, sleep. All these new things are all battling for that precious amount of time. And so I think to Steve's point, very specific conditions or focused solutions that can help people with a specific need that they're interested in to want to change. I think that's the power of data in the future.
I wanted to make sure that Steve fully understood where I was coming from. And you introduced a little bit of skepticism about whether or not we can identify an individual, reach out to them, and then apply care management. And I think we can go back and forth with that. But I agree I somewhat agree that that is not the be all and end all, and it's only as good as you have willingness on the other end of the phone. But I did want to point out that all of the ways that employers can marry HR data, productivity data, and medical and pharmacy data, including things like wellness and biometrics, is an improved sophistication in terms of, are our programs working? What's working? What's not? What is the value of making an investment in a particular area? Where should we invest our money, and where should we not? So I think it's as much using a much stronger way of measuring what's going on out there and some of the pairings of the data sets as a dashboard for how to run your business. But certainly from a human capital perspective.
Yeah, one comment I'd like to make real quick on this is also realizing that a lot of the data that we're awash in is actually more of a symptom than it is really getting at the cause of what's going on. Data points are just that. They're data points, and there's billions of them. And I think the biggest challenge right now for people in our positions as we're working with companies and health systems is really realizing that some of the most effective interventions are those that can actually get at the causality of where this problem started, not necessarily where it's at today. And a lot of the data that we're getting is on the consumer when the actual cause of the problem originates back to the physician. It's in the physician environment, it's in their practice environment. It's in the things like you mentioned earlier, Chris, related to their administrative loads, their inability to focus on patient care. And that's where we're seeing gaps, why everyone on this call has most likely some responsibility to actually fill gaps for the healthcare system today, because our diabetics aren't testing themselves and our surgeries aren't getting done right, and our specialty drugs aren't being taken correctly or administered correctly for some odd reason. So data has to be actionable, and it has to be pointed more at the cause than just kind of showing us what's going on right now. Awesome. Let's transition. Chris, you're going to field this one first for me. How is consumerism in healthcare changing, and how can healthcare keep up with this new demand for transparency and navigation?
So during our pre-call, Ron mentioned how the three of us, Steve, Ron, and myself, all come with very different perspectives and experiences. So I'm going to respond to this question with a very specific, weird example. And I'm going to talk about Domino's Pizza. And interestingly, over the 7-year period from 2010 to 2017, Domino's outperformed Amazon, Apple, Netflix, and Alphabet, who's the parent company of Google. So, that would surprise most people. But if you look at the technological and consumer-friendly transformation that Domino's has undergone over that period, you can order pizza by voice, emoji, chats from your car, from your TV. There's Domino's interfaces through all of those mechanisms. And if you've ever used their app, you know that you order the pizza and then it'll interrupt your purchase to try to upsell you on some chocolate cake. And it must work because they keep interrupting with these upsells, these buy-ups in that consumer experience. And so the parallel I want to draw is obviously healthcare needs to take cues on all these different modalities of interaction so that you can touch any type of consumer wherever they are, whatever generational background they come with and what their preferences are. There's no silver bullet, so you have to be able to have a bunch of different ways for people to interact with you. But that upselling and that interruption point, I think, is really important. And so there are a lot of models being built in healthcare right now with a concierge, an advocate, a navigator, a hub, trying to seamlessly stitch together all of these different programs and solutions and help keep track of them for the end user. And I think those incrementally help, but the next wave that we're starting to see is the interruption in the purchase. When you're searching for something, you're looking to see if a certain drug is covered or a procedure. Interrupting, offering an option, it's not chocolate cake, it's a higher quality, lower cost, virtual therapy, treatment decision support, some other thing that user should consider in the moment when they are most willing to be receptive, and then downsell them on something and try something less expensive with potentially better clinical outcome. So that's my Domino's example for you all to ponder.
Well, Chris, it's clear you have young kids, because in the last question, you talked about what must be your poor wife struggling to find those minutes, and you order a lot of Domino's and eat chocolate cake. So, been there, buddy. Hear you on that. I actually agree with a fair amount of that. And Ron and Chris and I agree a lot. We like to poke each other on these things. I would say that that's almost exactly how I see it. One size engagement doesn't work. How many of us remember the time when we're told, we all have smartphones, game over. Everyone's going to use their phones, and they're just going to do all the stuff we want them to do now because they have got it right in their phone. Why wouldn't they do that? Well, we realize it's much more complicated than that, and Domino's knows what a lot of companies in the consumer packaged goods space have known for a long, long time. You don't just hit people once a year or when you'd like to get them to do something. They do surround sound advertising. You're going to see it at the football game. You're going to see distribution channel at your Taco Bell, at your Pizza Hut, at your Domino's delivery. Everyone's going to have that brand of soda that you want to drink. You're going to see pop-up ads. You're going to see, you name it, television programs, sporting events. You're going to see it everywhere and at all times that might be needed. You're going to attach yourself to different moments in people's lives. So I do think that smart companies are getting to understand that. It's finally getting through, and innovators are better at that because a lot of these innovators come from those companies that actually taught us how to have freemium models for the apps on our phones and to offer that buy-up moment, Chris, that you spoke about. So I agree with where you're looking at that.
I'll comment briefly on this. I'll build on what Steve just said. Giving somebody a smartphone and an app that tells you the price of an MRI in your area has some value. But I think when it comes to seeing the doctor, when it comes to shopping for medical services, and again, the question here wasn't on pizza, it was on healthcare consumerism. So when people are, and to that point, when people are making serious decisions in their life, they need more hand-holding than I think that we had presumed maybe a decade ago. And so what we're already seeing in the industry, Steve, you probably know this better than anybody on the panel, cost transparency companies and patient advocacy companies are starting to come together and recognize that if we can provide somebody with intel on terms of how they might shop for their disease, they still might want to talk to somebody about what that means at that moment. Likewise, we're seeing second medical opinion. You could render a second medical opinion for somebody that needs it. What do I do once with that opinion? So bridging that with case management, we're seeing a lot of our vendors do that. Telemedicine, another great way of extending. We talked a little bit earlier about, I think Chris touched on some telemedicine, virtual care, if you will. Telemedicine and disease management, and establishing a regular contact with somebody that needs it. So when we think through consumerism, part of consumerism is make me aware of, and give me responsibility to manage my
I think we lost your audio, Ron, maybe.
We had to mute him because of the intense language he was using. So, Ron, we lost your audio. You can hear us. We could sign it. We can sign the rest of it. One question while we think. Technology. What if the employee was on a telemedicine or second opinion visit? He would have been dropped. Well, Ron's calling back in. I'll throw something out to Chris and Steve. There's a leader in the benefits space that recently called to me. He said, healthcare transparency. Some of these new companies, some of these new apps. He thought they were BS. He said it's not changing anything, or they're not working, or where are they pulling their data from to engage people? Like, what are your thoughts on that? As that becomes, I think a little bit more of one of those cool things. Is it real, or is it a bauble?
Well, maybe I'll start, since Ron run through the transparency, whatever to me. So I would actually agree with a fair amount of that. It's not that transparency isn't useful and advocacy isn't useful. It's that none of these things are everything. It's helpful to let people know what the prices of things are. But what's happened, if you look at that market, the market for transparency in particular, there was innovation, there was commoditization, and then there was real improvement on the part of the health plans in delivering their own solutions. So the marginal value of independent transparency goes down in that situation. The other thing that happened is there are some good studies that came out that have shown, in some cases, that there are savings, but that in other cases it may not be worthwhile. You be really, really careful when you're doing it, where you're doing it, and keeping in mind the point that many of us raised before, and I made an earlier comment. Some people just don't want to engage, and making the information available is terrific, but if I don't want to log on or use that app, I'm not going to. And if my doctor told me I really should go to this place, I might want to do that. So for some portion of the population, and sometimes in some instances as part of a well-communicated program, it can be helpful. To Ron's point, if you have somebody who's an advocate helping you make this decision and they're using that data with you, that may increase your chances. But again, we tend to overhype solutions in the healthcare space and anticipate they will be transformational. And we all saw this with the first transparency company. They came out with a massive market cap and then shrank back down. We just have to be wary of that. That's how things go. The hype gives way over time.
Yeah, I agree with those points. I think the word consumerism has rubbed me the wrong way for a while, because when you look at when people shop, why they shop, why they make their decisions, sometimes it's because they want to save money, sometimes it's they want to save time, because they're savvy and they want to make the best decision. A lot of times it's just because they're irrational and it's spur of the moment and it's emotional. And in healthcare especially, it's personal. And so we're irrational about a lot of the decisions that we make. Shopping in healthcare is also not fun. It's not like shopping for a tech gadget or for shoes or clothes or, we can't brag about it necessarily unless you go see the surgeon for your football team that's local, right? So I think healthcare has a lot of challenges from that perspective around getting people to engage with those types of tools to be better consumers. I think the next wave for employer consideration is not offering choice. and offering narrower networks, reference-based pricing, have the mechanics of the contracting behind the scenes force better choices across the board, regardless of whether the consumer at the end of the day engages or not. Any decision is a better decision.
Well said.
Yeah, great
I
point.
believe I'm back.
Absolutely.
Am I back?
You're back, Ron.
We hear you.
I said what I wanted to say. Keep going.
All right, so we're going to hit our last question here, guys. Who do we want to start? Let's have Steve start this one out again. Do you see any new ideas that you think are particularly interesting that may potentially boom in healthcare as it relates to how healthcare is serving our self-funded employers and their employees?
So many. The term ideas is such a big term. I'm sure each of us will take a different crack at this, but I'm going to talk about maybe approaches to some things that I think are really cool that companies are trying that are working really, really, really well to help employers meet their needs. And I think, Jonathan, you mentioned at the outset, but there's thousands of these companies out there that are offering new solutions. They all call themselves innovative, but we try to help our clients innovate with purpose and not just throw in something new. And we do think there are some things that are very purposeful out there. They're changing the modes of delivery, and again, that's something that we think is potentially really powerful, and we're seeing it work. I'm going to give 3 examples of companies that I think are interesting and new, because I'm going to take the idea to mean an idea through execution. So one of those is Hinge Health in the musculoskeletal space. Some of you have seen them before. The reason I bring them up is I just love how they're tackling musculoskeletal, which other companies are tackling as well, but they also add some really cool elements to that, like behavioral health and substance abuse assessments and cues, relationship with a coach that creates reciprocity in terms of behavioral economics, scarcity, and other behavioral economics cues they use to get people to engage and stay with the solution. They give gifts, and that creates reciprocity. So it's just smarter ways to take, in this case, an industry that really isn't delivering in many ways as an industry because it's not convenient to the consumer life, and creating a way to do that remotely and more effectively. Another example of a very similar situation to that is in behavioral health. And this is something that, Ron had mentioned before. It's enormously important, but the EAP programs, we hear so often from our employers, they're just not providing any value. Such a small percent of our population are using these programs. They're good programs, but what do we do? And that's why there's an industry that's forming, and it's still too early to call winners here. There's a shakeout happening, but really excited by companies like the one I mentioned, Wobot, like Joyable and Happify, and Sleepio, now Big Health, that are challenging that old approach. Talkspace, all these companies, Ginger.io, are out there trying to add care delivered in different ways, not just by professionals, but by chatbots, by professionals that are leveraged, because the therapy model isn't a very leverageable model. So really excited about ideas there. And the last one I'll mention is in the area of diabetes. I love what Virta Health is doing in terms of trying to reverse diabetes. Again, it's a different way of looking at care. It's a way of taking people that the industry has written off, saying you're diabetic and this is how your life is, and saying there's actually going to be some things we can do to bring you back to a prior state. And of course, there's science and limitations to all that. But those are just a few examples of what we're really excited about. Some problems that have been really difficult to approach, that we're seeing some innovative, novel solutions take hold.
I like most of the companies you listed off, Steve. So mostly in agreement with what your comments said. I'm going to take a different angle. When I read this question, ideas that may potentially boom, I was like, boom like the gold rush, or boom like explode like dynamite? And so you see it both ways. I'm going to take the positive outlook. And Steve went down the list of behavioral health and musculoskeletal and diabetes, cardiovascular health. Those are the top conditions for most employers across the board. I think the flip side of that is on payment integrity. It's fraud, waste, abuse, subrogation, out of network, billing adjudication. It's a space I think all of us on the advisory side should be pushing for greater transparency. in the interest of our clients. And, we're all trusted advisors for the employers that we work with. And so greater diligence and investigation into the payments that are occurring behind the scenes in all those condition categories that Steve listed off and more, the stuff that runs behind the scenes. And so that's a huge area that we've been trying to shine a spotlight on.
Any companies there?
There are some that are more vapor than real. We're actually going through a process evaluating a select number that have passed our technology privacy compliance review. Since they're handling so much data, we wanted to make sure that their systems are at the snuff. So no one yet that I want to comment on, because it's still an emerging space. The health plans certainly all have their own programs as well. Sometimes they're automatic, sometimes there's a buy-up, and they may have partner programs to consider. So that is also an option to look at. It is, in some of our employers' views, it's what they're paying their health plan partner to do already. And so to be asked to do a buy-up, the question comes up, well, why don't I just carve this out to someone else who is really, I'm their client. I'm their only client versus, having relationships with the provider system. So we see solutions on both sides of the fence emerging there.
Do you want to share with us some of the vapor ones so we don't have to waste our time?
I'm going to be nice and not put anyone on the spot.
Ron.
Yeah, two areas I want to mention. One is similar to what Chris just said. I'll couch it in high-cost claimants, because a lot of the payer transparency, the claims auditing that Chris referenced, nowhere is that needed more, and nowhere are we seeing in general a pretty weak effort with regards to what we're getting from some of the traditional ways of looking and monitoring claims than we do in high-cost claimants. So large, complex claims review, large, complex, high-cost claims management. I threw out similar stats last year. If you just look at claimants over $25,000, that's only 4% of your members. That's driving 58.6% of your business when we look at our data. And then the last thing I want to, so in other words, pressuring the industry to bring real solutions around when people are spending $75,000. What does that mean? Where are there savings to be had? Where are there savings that are not to be had? And understanding where you do want to spend that. And there are companies that are, Jonathan, to your question for Chris, there are companies that are starting to emerge. And this is an area that we're constantly talking to carriers and vendors and encouraging them to come up with better solutions. The last point I'd like to make, and Jake, certainly this will be near and dear to your heart, pharmacogenomics. So again, medical science and the way that prescriptions are prescribed is changing tremendously. And our ability to determine who's going to have a good response to a medicine and who's going to have a suboptimal response to medicine for certain conditions, notably antidepressants, antipsychotics, some of the hypertension medicines, cholesterol, nonsteroidals, opiates, estrogen antagonists, barbiturates, antivirals. We are just now starting to be able to introduce testing to determine whether or not the drug that the doctor wrote for an individual, if you're a candidate for it, or if there's an alternate that would work so much better. And I know that Jake, RX Precision, your company, and just a handful of others are starting to recognize that leveraging the employer self-funded self-interest in optimizing what is or isn't being leveraged, there's a lot more that we can do that carriers are not yet there to be able to deploy. And so I do encourage, and I think in the upcoming conference in Orlando, there'll be a fair amount on both precision medicine and pharmacogenomics. That's an area I'm very excited about.
Yeah, and just to add to that, the great thing about that area is the science is extremely well established, so we're not second guessing whether or not we know what we're looking at when it comes to a gene metabolite heading through a metabolic pathway and being broken down and used the right way in the body. We know that now. The other great thing about it is it spans all of the major high-risk areas that we're all concerned about. It hits specialty drugs, it hits cardiovascular, it hits diabetes, it hits the psych world, and it hits pain. And I think those are all the things that we're keeping our eyes on as far as what's coming down the pipeline, as well as what's costing us the most in our health plans today.
And it's uncharted territory. So, we start to get into older physicians and younger physicians, that's the way things go, will probably be much more engaged in that sort of thing. And it'll definitely become very new school in terms of how medical care is delivered. So I think in the near future, we're going to see a groundswell of employers who are going to start demanding, I want to make sure that we're leveraging this new technology. Carriers are already leveraging it and have it embedded in terms of cancer genomics and using genotyping for tumors for certain ones where you can really fine tune what the right chemotherapeutic agent is. That's already being done. That's kind of on a national level. Most oncologists are educated in that. But in the areas that I described, psychiatric, cardiovascular, we're still in a slow-moving field, and the provider community will make sizable changes in the foreseeable future, next 3 years, let's say.
Absolutely.
Steve, Chris, any comments on genomics?
Go ahead, Chris. You go first.
A huge space. I think gene therapy is certainly emerging, and today you can cure a rare type of inheritable blindness, and the price of giving someone sight is $400,000 to $500,000 per eye. So, that's very rare, but a rare disease. But there's 60 million other people who suffer from some type of rare inheritable disease that could be treated with a similar type of pathway. So it is exciting times that we live in, but some big time decisions around what things are worth treating at what price.
Yeah, I would just add to everything that was just said before, really no difference, except to cap it off with a lot is happening in the genomic space. There's an enormous amount of activity from non-valued companies. This discussion focused on real value. And I'm really excited about oncology, the potential. If we could actually solve behavioral health medication treatment, I feel like the science is just starting to get there. There's a long way to go, and it's so complicated. But by God, if we could do this, it's magnificent. It really can change people's lives and transform spend to real value and enable value-based contracting, so many things. And just, I would say, be careful for the employers out there, because the genomics bandwagon is very, very long and entails a lot of snake oil today for companies who are just selling commercial tests, the kinds of things that Jake, you pointed out at the beginning that are more entertainment type of solutions, and the real science, I think, is very promising.
And there's some stuff going on in the back end where, employers or brokers might adopt this, find out it doesn't work, there's no engagement on the back end, or they haven't even dove into what's going on with the genomic data, who's selling it, who's it going to, who's making money off of it. So I think some of these things, will emerge. We'll be talking about some of these at our conference, but I think you do have to be very careful in the space and, strategically aligned with the companies that really are providing value, and it's not just feel good or sounds good.
Absolutely. Gentlemen, thank you so much for participating in this wonderful panel today, and looking forward to being with all of you in Orlando at the end of October. Jonathan, do you want to close us out?
Yeah, no, thank you guys for another rockstar performance. Look forward to seeing you guys in I think almost 2 months in Orlando. Once again, anyone who's on the call, we're going to make this video available if you want to watch it again or share with your colleagues. If you want to register this week, we have a special code for those innovators who are following the rock stars in innovation on this call. Use Disrupt 18 at the website, healthcarerevolution.com, to save $800 off. And if anyone has any questions, feel free to email it. Happy to distribute amongst the panelists. And thank you guys for sharing your valuable time with us, and have a great rest of the week.
Thank you all.
Take care.
Thanks, Jonathan. Bye-bye.